This is an article that came out in the Washington Post, March 10th, 2018. Dentists keep dying of this deadly lung disease. The CDC can't figure out why. 7 of the patients were dead, and 2 were dying of a rare chronic progressive lung disease that can be treated but not cured. It's estimated that about 200,000 people in the United States have idiopathic pulmonary fibrosis, IPF, at any one time. But the common denominator of a small group of patients at a Virginia clinic over a 15-year period is worrying the Center for Disease Control and Prevention. 8 were dentists, and 1 was a dental technician. So, what they're saying is they believe these dentists and professionals that are working in these dental offices is being impacted by something that's poisoning the environment in these dental offices. I mean, look, America is so full of toxins and chemicals. It's no telling what one or multiple things in that dental office that's causing this. The dental professionals were 23 times more likely to have IPF than the rest of the population. The CDC had released this in a report. So it's being investigated and everything because they still can't pinpoint what's causing it. IPF causes scarring of the lungs, according to the report. It can be slowed, but nothing can remove the scar tissue. Over time, the lungs have difficulty getting oxygen to vital organs like the heart and brain. In April 2016, a Virginia dentist who had been diagnosed with IPF and was undergoing treatment at a specialty clinic called the CDC with a warning. Several other dental professionals had sought treatment at the same facility. Investigators dug deeper, poring over nearly 900 records of IPF patients at that clinic over a 21-year period and found the 9 patients with the common work history. The median survival age of IPF after diagnosis is 3 to 5 years. Wow, they really don't have that long. But first, patients experience shortness of breath, a dry chronic cough, weight loss, joint and muscle pain, and clubbed fingers and toes. Wow. So they said it could be coming from the appliances that they use in the office to polish um, teeth, but they're not sure. You would think that, there was some kind of way they could test the environment in these dental offices and find out what's going on because, this is pretty scary. There's a lot of people that are coming and going in those dental offices. And when you see something like this, you have to wonder how many patients are being impacted. I know this article is really focusing mainly on the dentists. Older dentists usually fare worse, both because of increased opportunity for exposure and because they may have practice at a time when safety standards weren't as stringent. We do work with materials and with human bioproducts that are potentially damaging to our bodies if we inhale them. Paul Casamessio. Let's see. For example, the dentist who alerted the CDC never smoked, but reported not wearing a National Institute for occupational safety and health certified respirator during dental activities throughout his 40-year dental practice, the CDC said. During the past 20 years, he started wearing a surgical mask, which still may have been inadequate. More work has to be done before we can make any conclusions about the risk dentists or other dental personnel have. Randall J. Nett, lead author of the study and medical officer with the U.S. Public Health Service, told CNN. Even though CDC investigators have not figured out what specifically caused IPF in the patients, the study's release may still do some good. Now they're talking about IPF in the patients. And see, they're going to make me scared to go to a dental's office. Before, workers exposed to dust from wood and metal have been warned to take precautions to prevent IPF. But this is the first time the CDC has warned that dentists and the people who work in their offices are vulnerable. And IPF may not have a cure, but there are protective measures, namely proper ventilation and wearing a respirator during certain procedures. So there you have it, ladies and gentlemen. The dentists are developing a rare lung disease, and at this point in time, they can't determine exactly what's causing it within those dental offices that they're working in. Please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell twice and join me on Black Junction TV and blackspot.com. Peace, family.